Good morning to all of you. So today we are going to study part 1 of ethical and cultural issues. So today I will be discussing related to ethics, and the next class will be related to cultural. Now, clinical problems with significant ethical implications pose an ever increasing dilemma in everyday medical practice in the 21st century and rarely present a simple solution. This is particularly the case with ethical issues involving children and those unable to take decisions. Okay. Now, almost every day we are faced with ethical decisions. Ethics are basically, which we shall be studying the definitions in future slide, where we are concerned with doing right or wrong. So that is the moral issues which comes under ethics, and apart from that we have certain general principles also. So keeping all that in mind, we have ethical implications which we come across on a day to day basis, and the issue concerning children is children are unable to take their own decisions. So it is the parents, and their decisions are facilitated by the healthcare professionals. Okay, so the ethical issues plays a very important role in the day-to-day problems. Now, when the parents' interest should come first and all personal, cultural, religious bias eliminated, the impact of costly treatment for individual patient on the available healthcare resources must also be taken into account. Okay. So, when we are interacting with the patients, the first thing we should come in mind is the welfare of the patients. Our personal issues or our cultural issues or our religious issues. We may be having maybe a personal grudge maybe with some patients, or maybe a particular group of patients, or maybe a particular original. For example, if you take example of foreign countries, Americans may be looking down upon the Indians. So this is one of the examples. Okay. So we are residing in India, we may be having maybe a bad mindset about a particular group of people. So whatever it is, it may be personal, it may be cultural. Your cultural background and the cultural background of the patients may be different. Your religion and the patient's religion may be different. So all this bias has to be eliminated, and apart from that, the impact of costly treatment for the individual patient on the available healthcare resources also must be taken into account. So one thing to remember is healthcare is now very costly. Okay. So when the patient is coming, many a times he may not be even able to bear the expenses. So that is the situation when the patient is coming. So when a child is being admitted to the ward, the child's interest or the patient's interest has to be forefront, and our personal, our cultural, our religious background should not hinder our care to the concerned child or the patient. Now, parents and guardians generally make a choice about the children's health and services because children are unable to do so. So, who is taking care? Parents are taking care. And for those children whose parents are not there, the guardians are taking their decision related to the health care. So, as legal custodians of minor children, they decide what is best for the child, and nursing care for the children and their families make the child and family needs a priority. So, parents are legal custodians. So, unless and until the child is 18 years of age, he is not empowered to put a signature that he has to go for surgery. He cannot, we cannot take an informed consent signature from a child who is small, less than 18 years of age. So, parents are the legal custodians of minor children, and they decide what is best for the child. And the nurses caring for the children and their families make the child and the family needs a priority. So, as nurses, as pediatric nurses, when we are taking care of the child, the families also comes. It's not only the child, but the families are also part of the care we are giving, and the child's care and the family care is the most priority thing. Okay. Moral development, legal and cultural requirements involving in taking care of the children affect the pediatric nurse on a daily basis, because pediatric nurses come across children who are of different age groups. So, their moral different, their moral development is different at different ages. The culture is different, the legal issues are different. So, this affects the pediatric nurses on a daily basis. So, pediatric nurse must function within the ethical and cultural boundaries related to the care. So, as nurses we have to know what are our ethical boundaries, we should know what are the cultural boundaries. See, every different cultures have their different issues. We shall be studying about cultural issues in the part 2 of the presentation. So, different cultures are there. So, we need to, suppose if I am a nurse who is posted in Chhattisgarh, so I need to know what are the cultural backgrounds of the people who are being admitted in the ward. So, if I know the culture, I will be able to respect them, and I will be able to understand their issues. Okay. So, we have ethical boundaries also, we have cultural boundaries also, and within that boundary the pediatric nurse must function, and we have to understand the ethical and cultural requirement for routine care, consent for treatment, hospitalization and research. So, this we have to understand whether we may be doing research, or we may be nurses who are posted in hospital, or we may be a nurse who is giving a routine care, or we are taking consent for treatment. So, it is very important that we have to understand the ethical requirement as well as the cultural requirement. Okay. I will give an example. Suppose if you want to take consent consent for surgery. Okay. The mother might be with the child. The mother will be telling, the mother is above 18 years. Okay. So, we can take signature from the mother, but usually what the mother will tell, अरे अभी नहीं इनके पापा आने दो, तब मैं आपसे वो आके आपको दस्तखत देंगे. Okay. So, as pediatric nurses, I have to understand the importance of father in the family. I cannot force the mother, you have to put the signature. So, things have to be changed in emergency situation. I am not talking about emergency situation, but we need to be sensitive to such issues. If we know, yes, suppose the putting signature for surgery will usually be done by the father, even though a mother might be present there. Okay. So, these are the things which we need to be sensitive and we should respect. Now, what is ethics? The ethic comes from a Greek word ethikos, which means moral character. Okay, moral or maybe character. The branch of philosophy concerned with distinction between right and wrong, based on a body of knowledge, not only and not based on opinion. So, that is the definition of ethics. So, what is ethics? It is distinction between right or wrong. We have a body of knowledge, and based on the body of the knowledge, there are some aspects which are right, there are some aspects which are wrong, and doing what is right and what is wrong will be defined by that particular body of knowledge, and not based on opinions, Okay. According to me, this is okay. For example, if you are standing near the traffic light, for example. Okay. If you are standing in the traffic light, some people might cross the red line, some people might not cross the red line. Okay. So, what is right? Standing just away from the red line, that is right. I cannot have opinion, even what will happen if I go few steps in front of or beyond the red line. So, that opinion does not matter. The ethics is, this is right based on the body of knowledge. And what is the body of knowledge? Maybe the rules of traffic is the body of knowledge. Similar to that, we have so many procedures which are to be done for the patients. So, there are certain guidelines, what to be done and what not to be done, and how it is to be done. So, all these things we have a body of knowledge, and based on the body of knowledge we have to do the right thing. So, that is ethics, and not based on opinions, it is not based on opinions. The term ethic comes from the Greek word ethikos, which means moral character, and ethics is the study of a rational process for determining the best course of action in the face of conflicting choices. Okay. So, you may have conflicting choices, what to do, what not to do, and what we decide best is, that is ethics. Okay. So, ethical principles are general statements about what type of actions are right or wrong, including we have principles of autonomy, beneficence, non-maleficence, justice, what it is we shall be studying in the subsequent slides. Okay. Medical ethics are concerned with moral questions based by the practice of medicine and more generally by healthcare. Okay. So, what is medical ethics? We are faced by some moral questions when we are practicing medicine, and especially when we are taking care of the family. Okay. So, we are concerned with moral questions. So, that is medical ethics. Now, ethics are involved or influenced by many factors, which are, first is laws. Laws play a very important role in deciding ethics. Laws gives us information what is right and what is wrong. For example, a doctor orders penicillin injection to be given at 9 a.m. Okay. So, that is the law. Okay. And as it is a OD dose, it is the job or maybe it is the responsibility of the nurses to give the injection penicillin to a particular patient at 9 a.m. Okay. And what is the law? Law is if you do not give it and if something occurs to the patient, we can be taken to the court. So, ethics are defined by laws. Next is religion. Religion also plays a very important role in different religions have different ethics, and based on different ethics we have to follow. Okay. So, different religions have their different way of maybe doing last rites, or maybe at the birth, or whenever they receive the baby. So, different religions have their own different practices, and depending on those practices we have to respect the religions. Okay. We have to do whatever is right based on the religion which is followed by the child or the patients. Scientific studies also guide us, and based on the scientific studies we decide what is right and what is wrong. Philosophy also plays a very important role. Okay. Now, morals is we have our own moral values, what to do right and what to do wrong. So, based on that ethics plays a very important role. So, now what are the factors which are affecting the ethics? Okay. So, professional ethics are basically divided into two factors. One is internal factors, second is external factors. Internal factors are divided into individual character and responsibility, which has accountability, work conscience, positive energy in dealing with with others, and self control skills. And in communication challenges we have relationship between doctors and nurses, relationship between staff, relationship between a nurse and the patients. Okay. So, these two, individual character and responsibility and communication challenges, are included in internal factors, whereas external factors are divided into three. One is organizational preconditions, second is support system, third is education and cultural development. In organizational preconditions we have facilities and equipments, observance, nurse patient ratio, heavy workload and shortage of staff, nurses' right to choose their own ward. And in appropriate support system, flexibility and effective reward and punishment. And educational and cultural development includes model teachers, rethinking in the behavioral processes, cultural development, and practical and theoretical training in ethics. Okay. So, what are these things we shall be studying in the subsequent slides. Okay. So, internal factors include, first is individual character and responsibility. Okay. Here we are basically studying what are the factors which affects the ethics. So, in that, first is individual character and responsibility. In this, first is accountability. So, here it is written, if the nurses devoted themselves to their work sincerely, accepted their responsibility and acted accordingly, the patients would receive medical care properly. For example, a nurse might use his or her hand, for example, by putting it on the patient's forehead to see if the temperature was normal instead of using a thermometer. So, such inappropriate methods could jeopardize the patient's health because there was a high possibility of making mistake. We are accountable for our actions. Nurses are accountable for our actions. Okay. So, if nurses are doing sincerely whatever is expected to do, they may be posted maybe in ICU, or they may be posted maybe in emergency department, or wherever they are posted. all nurses are expected to do the work sincerely. They have to take responsibility of whatever job is assigned to them, and ensure that whichever patients are assigned to them, they should get good care. So, here an example is there. Instead of using a thermometer to take the temperature, if we just touch the forehead or skin of the patient and decide, हाँ भाई ये तो normal है or maybe more 100 ही होगा. So, this if you do it, then this can hamper the person's health. So, this should not be done. Okay. So, we have to be accountable for our actions. Second is possession of positive energy. Nurses should provide with positive energy for patients and their relatives, reinforce the spirit of recovery and create a sense of hope. Okay. So, nurses are with the patients, and some patients may be having serious health issues. Okay. And the diagnosis of the child may be such that we may be knowing that the child may not survive long. Okay. In spite of all this, the nurse should give a positive energy to the patients, reinforce their spirit to recovery and create a sense of hope. Here I would like to give an example. A few days back there was a video somebody had sent to me. So, in some hospital few weeks back. Okay. So, a nurse is taking care of a COVID patient and she is telling, अब तो आप 2-3 दिन के ही मेहमान हो. Okay. So, what is she doing? She is creating not a sense of hope, but she is creating a sense of hopelessness. She is creating a sense of hopelessness. Okay. The spirit, she is not reinforcing the spirit to recovery, but if the nurse is telling कि तुम 2-3 दिन के ही मेहमान हो, the patient will to fight against the disease will go away. The family members who are listening, they also will lose their hope, because a nurse is telling that this child will not survive, not more than that. So, nurses, even though it may be a negative situation, we always have to create a sense of hope, है ना. How do we create a sense of hope? भगवान पर भरोसा रखिए, जिस भी ईश्वर को आप प्रार्थना करते हैं, है ना, वो आपके साथ है, हर स्थिति में आपको आपके साथ है ना. तो समथिंग लाइक दिस. सो दिस इज क्रिएटिंग अ पॉजिटिव एनर्जी फॉर द पेशेंट्स, है ना. नहीं तो अरे ये तो अब मेरा आखिरी इंजेक्शन है, इसके बाद तो देने की ज़रूरत नहीं पड़ेगी क्योंकि अब ये 1-8 घंटे से ज़्यादा नहीं रहेगा. So, that is not positive energy. So, we all have to keep this in mind. Next is internal control skill. Professional nurse has to be able to concentrate in different situations. Okay. So, I was reading about this point and a nurse was describing her situation. She was explaining that she had a patient with multiple fractures in her ward, and because of the multiple fractures the patient was in great pain, and because of the pain he was using very bad language. But in spite of all this, even though the patient was using bad language, the nurse did not lose her cool. The nurse who was taking care of the patient smiled and took care of the patient, and gradually the bad behavior which the patient was exhibiting was reduced. Okay. So, that is internal control skills. Okay. I will give you another example. A child died in a pediatric ward, and the family members created a great halla gulla. There was a ruckus around the ward. It was a very chaotic situation. The parents as well as the family members, they were shouting at the top of voice because they believed that the child died because of the mismanagement from the hospital authorities. So, because the child had died, the mother was crying very bitterly and was sitting near the patient's bed. So, a nurse went, she did not utter a single word, but she embraced the mother and stood like that. So, the chaotic situation, the big chaos which was there in the ward, when they saw the nurse, she did not use a word, and she only communicated her non-verbal communication. And gradually when all saw a nurse just holding the mother without saying a word, she just embraced the mother. So, that quietened that chaotic situation. So, that is internal control skill, the ability of the professional nurse not to react even in difficult situations. Okay. Next is communication challenges. So, as being healthcare professionals, the nurses have to interact with so many people. There has to be communication between doctors and nurses, there has to be professional relationship between staff, the nurse patient relationship is there, and effective communication interaction in the workplace. All these areas have to be managed very properly, otherwise if communication is not good, then the whole work gets affected, and finally the patient is will be a recipient of a bad care. Okay. So, the communication challenges have to be overcome, and sometimes you may find that the doctor may not be behaving properly with you or with the nurses, or even though the nurse may not be at the fault, but the doctor may be blaming. So, all these issues might crop up. So, when we are interacting with the patients, so those issues should not come in taking care of the patient. Okay. So, this has to be kept, and whenever the professional relationship among staff, the professional relationship between maybe staff in charge and a senior staff, junior staff, student nurses. So, there has to be a professional relationship and a communication which has to be maintained. Okay. The good nurse patient relationship also plays a very important role, and effective communication and interaction in the workplace. Okay. So, next, so that was all about the internal factors. Now, we will come to external factors. In external factors is organizational preconditions. What are those? Hospital facilities and equipment play a very important role in practicing professional ethics. Non-standard equipment can interfere with providing proper care and may even mislead the staff judgments about patient condition. For example, temperature control device showed lower than the actual degree. Okay, and organization structure should be compatible with nursing professional knowledge. Okay. Hospital facilities and equipment play a very important role. Okay. If the equipments are not so good, so that badly affects our care. So, here is an example of a poor temperature control display system. Okay. And now, you must have seen in COVID situation, we can record the temperature of a patient without touching by using an infrared. Just you have to in the forehead or maybe in the hand, you need not even touch, you will have a display of reading. But if that machine is not functioning properly, if you have a patient who has fever, but this machine is showing a normal temperature, so that can be hazardous, and that can be hazardous for hazardous in terms of ethics. Okay. And next is organizational structure should be compatible with nursing professional knowledge. So, depending on the nurses professional knowledge, the organizational setup has to be there, then only the proper care can be given to the patient. Next is inappropriate nurse patient ratio and heavy workload. If you have less number of the patients taking care of a large number of patients, so we can take example of COVID situation. So, there was staff crunch each and everywhere in a world scenario, this was the issue. So, when you have less number of caretakers, patients are more, the issue is the ethical standards are bound to come down, but a nurse has to try her level best to ensure that whatever possible can be done has to be done, and nurses have proved time and again that they are giving good care. Okay. So, many videos you must have seen here also. So, many videos they were thankful to the nurses, even though they were busy and still they responded to whatever calls which the patient were making. Okay. So, inappropriate nurses patient requirement heavy workload, this is a barrier or a hindrance in giving good care to the patients. The nurses' rights to choose their own working places and hospital. Okay. So, this opportunity could affect the application of professional ethics. Each of the nurses have their specialty areas. Some people may be interested in pediatrics, some people may be interested in psychiatry and so on. Okay. So, somebody who is interested in pediatrics, if she is posted in psychiatry, then she will not be able to perform so well. So, studies have proved that if the nurses have the right to choose their working places, they will be able to practice ethical standard better as compared to not getting a chance to choose that. But many a times we may not have the liberty to do so. Why? Because many nurses may be opting for a particular area, then very few nurses may be available who are available to work in other areas. So, if it is possible, it is better to do, but many a times practical difficulties are there where this opportunities may not be possible. Okay. Then in external factor, support system, effective support system encouraged to observe the professional ethics. So, whenever problem is faced, support of the supervisor is very important, and a proper system of reward and punishment could enhance the experience of professional ethics. Okay. Support system is very important. See, all of us are expected to perform the whatever work is assigned to her. So, whenever we have a particular problem, we expect that the seniors or the supervisors should support us. Okay. Suppose a nurse is there, she is alone in the ward and she has to manage 50 patients. When a nurse supervisor comes, if she sees, yes, she has to manage so many patients, and if you have extra nurses, maybe a nearby ward may be having 3 nurses. So, what she will do? She will call one nurse from a nearby ward and ask her to be with this at least for 3 to 4 hours. So, what is she doing? When a problem is there, the support of supervisors are there, but if the support is not there, then ethical standards will not be able to practice properly. Next is a proper system of reward and punishment could enhances the experience of the professional ethics. So, if proper award system is there, good work, maybe appreciation letter, or maybe some monetary benefit, or maybe a simple word of praise, even that works wonders. Okay. So, if you have a proper system of reward and punishment, somebody is doing wrong and nobody is there to check it. So, then if this is a situation, then what happens is somebody who is doing good, so they will think, what is the use of doing struggling so much when nobody is appreciating it, and somebody who is doing wrong is not at all being corrected. So, that causes a problem, problem also for those people who are doing right. So, there has to be a proper system of reward and punishment. If you do good work, it has to be rewarded. If somebody commits a wrong, they have to be punished, so that next time others also will be vigilant not to commit mistakes. Next is flexibility as a necessity for nursing. Okay. So, nursing practice requires that even if a patient is too demanding, he or he had challenges with us, we should never deprive him from these services. Okay. So, what happens is nurses has to be flexible according to whatever situations is there with the patients. Okay. Sometimes patients may be behaving nicely, sometimes patient may not be behaving nicely. So, we need to be flexible depending on whatever situations are in front of us. So, we should ensure that we should never deprive him from our services. So, depending on whatever will the situation, we nurses should try level best to ensure that nursing care should not be deprived to any patient. Okay. Next is efficient way of punishment and reward system. Okay. So, it would be helpful for the nurses to get a positive or negative feedback. So, that has to be there. So, if the monitoring system rewarded the nurse when they do the duties efficiently, so studies have proved that they would be encouraged to work 10 times more than they are expected to, otherwise they lose their motivation. So, if somebody is gets a reward, for example, there can be a yearly function. For example, in our hospital, what we have is we have a hospital day where awards are given, hospital day awards are given, maybe to a particular unit, or maybe to a particular group of persons, maybe single persons, different categories are there, rewards are there. And what is the maximum benefit of this award? Not the money which is coming as a reward, but the motivation which comes out of it. So, that becomes a great motivational force. So, somebody is being rewarded, other nurses also get motivated, she is getting a reward this time, I have to work it nicely, so that next time I will get a reward. So, something like this. So, this when awards are there, so they are encouraged to do the work 10 times more efficiently as compared to other things. Okay. Now, educational cultural development. A nursing instructor should be aware of the effects of training methods on training. So, as nurse educators, we have to keep in mind the type of training which we are giving on trainings. Suppose if some teachers are making fun of some students who are not so good in studies in front of everybody, so that demotivates the person to a great extent. So, whenever nurse educators are correcting somebody, they have to ensure that the words which they are using, the accent which they are using, their non-verbal communication, the way how they communicate, all these things should not hamper the motivation of those children who are in training. Experienced nurses have the skill to manage emergency condition even in absence of doctors. Okay. So, a nurse who is experienced, suppose if a nurse is posted in ICU, if somebody has a cardiac arrest, she will not wait for the doctor to come. Why? Because it can take the life of the patient. So, she is so experienced, or he or she is so experienced that she will be giving CPR, and she will be doing in a better manner also. Okay. So, experienced nurses have the skill to manage even in the absence of doctors. The role of instructors as role models in creation of students' ethical behavior is very, very important. So, that has to be kept in mind. The role of instructors as role models. Okay. Suppose if a teacher is there, if she is not coming in time to the class, she cannot expect, or if she is telling the students come in time, then the students will be telling, अरे ये तो time पे नहीं आती, फिर कैसे हमको बोल रहे time पे आने के लिए. Okay. So, that if we want that the students' ethical behavior should be maintained, the role of instructors has to be they should serve as role models. And ethics education improve the students' awareness from ethical issues, and their application in the workplace is effective. Studies have proved that if students are trained in ethics, so they are able to practice those ethical behavior, and which will be effective. Okay. So, that was all about factors, internal and external factors which affects the ethical behavior. Now, we shall study what are the ethical issues. First is refuse immunization. A large number of parents refuse to vaccinate their children despite evidence dispelling myths and supporting immunization. So, some parents will tell कि हम immunization नहीं देंगे, we will not be taking immunizations. Today there was a newspaper report that many doctors are not taking COVID vaccination. Research have proved that taking COVID vaccination is very beneficial, but many doctors are not taking, and the research studies have proved that those who are not vaccinated, they suffer from serious consequences. So, that is same with the vaccinations which the children are getting. Sometimes parents may not agree to give vaccination, even though there are studies that taking vaccination will improve the quality of life or prevent from diseases, but still parents may refuse. So, this is one issue. Refuse seek care. Parents have the responsibility and authority to make medical decisions on behalf of the children. Okay, because children are not empowered to do so. So, this includes the right to refuse or discontinue treatment, even those that may be life sustaining. However, parent decision making should be guided by the best interest of the child. Okay, in cases refuse seek care, sometimes parents may take a decision that we are withdrawing the treatment. Okay. So, they may have the right to refuse or maybe discontinue the treatment, and those treatment may be life sustaining. Life sustaining means if you do not give that particular treatment, the life will not be continued. Okay. However, the parent decision making should be guided by the best interest of the child. So, being parents, they will decide what is best for the child. Okay. Some parents, suppose the child is having some terminal illness. Okay. Maybe some brain tumor, or maybe some terminal illness because of which the patient has to take maybe leukemia, and the child requires chemotherapy. So, the parents will be thinking the side effects of chemotherapy. So, the parents may decide that we will not take treatment, we will accept it whatever it is. Okay. So, it is life sustaining, but the parents may decide that they may refuse, or they may discontinue. The child may take 1 or 2 chemotherapy and then the parents are refusing that we will not continue treatment. Next is genetic therapy. Genetic therapy involves making changes to body set of basic instruction, and it raises many unique ethical concern. Okay. Genetic therapies are available, they are very costly, and second thing, it requires a vector to take a particular gene inside the body. So, ethical issues are there. So, when you introduce a vector, it may target a wrong area. So, if it is targeting a wrong cell or a wrong tissue, this can even cause tumor. So, this all requires a lot of ethical issues. So, genetic therapy is another area with multiple ethical issues. Next is withhold therapy versus withdrawal of treatment. Okay. A decision to withdraw or withhold the treatment may seem like giving up. Okay. Treatment is going on and the decision is there, we will not continue it. Okay. But when physicians, patients and family members communicate effectively as a team, it can be very satisfying and empowering. Okay. So, here is if you withhold the treatment or if you withdraw the treatment, this is the efficacy of the child will survive only for this much time. So, the medical team has to give the correct information about the availability of treatment and the life expectancy, especially in cases of chronic illness or maybe acute illnesses for which the life expectancy is poor. So, in such condition, there may be withdrawal of treatment or maybe the therapy is withdrawn. So, but when it is communicated effectively as a team, then it can be very satisfying. Okay. So, especially in cases of chronic illnesses where treatment may not make much sense. Okay. So, it is better to withdraw treatment. So, this all depends on the parents' wishes, what they decide what is best for the child. Then informed consent. The most important goal of informed consent is that patient has an opportunity to be informed participant in healthcare in her healthcare decisions. Okay. So, in informed consent, the information regarding what treatment to be given, what are the risks, what are the benefits, what are the alternatives available, and there has to be opportunity for questions. So, informed question is not taking just the patient's case sheet where signature is taken, हाँ भाई आप signature कर दीजिए, it is over. Not that is not informed consent. That is only consent. Informed consent means we have to tell that this patient, this is a treatment which we have to go, which we are doing, these are the risks and these are the benefits. If you do not take this treatment, this can occur, and if you take this treatment, these are the benefits. If you do not take this treatment, these are the alternatives, and after that there has to be opportunities for the parents to ask, or if the child is old enough, they should have the opportunity to clear their doubts by asking the questions. Okay. So, this is the procedure for informed consent. Okay. So, pediatric nurses are trained in child development, healthcare and diseases of the children. They deal with infants all the way up to the adolescent children. So, pediatric nurses are not concerned only for newborn baby, they have to deal with from newborn to adolescent children. So, these type of nurses specialize in examining both the physical and psychological well-being of the child. Okay. And the ethical issues the pediatric nurses face can be quite challenging at times, and they must most often professionally solve conflicts involving the family's personal values. So, when such issues are there with children, health issues, and the parents may be taking decisions which may not be according to the decision what the nurse may be expecting. So, such conflicting decisions might be there. So, the nurse is facing all such ethical issues on a day-to-day basis. So, general ethical principles in pediatrics, what we will be learning in the next class. So, thank you for the patient listening. Thank you so much.